In this video, we are going to talk about tendinitis. Now, tendinitis basically means inflammation of the tendon, and this can happen at any place. For example, you can have plantar fasciitis, you can have tendons around the knee getting inflamed, patellar tendinitis, you can also have Achilles tendinitis, and so on. Now, there are different modalities of treatment that can be used, like medication, for example, non-steroidal anti-inflammatory medication, as well as injection of steroids into the tendon, as well as injection of PRP, and physiotherapy and stretching exercises and so on. However, there's a specific problem or a specific place where you can have tendinitis, which is Achilles tendinitis, which can be quite resistant to treatment, especially if it is chronic. Now, what happens in this situation is that there is scar tissue formation, and because of the scar tissue formation, the problem tends to be quite resistant, and one of the newer treatments that can be tried for this successfully is what is called the shock wave treatment. Now, when you apply shock wave treatment, what happens is the chronic injury becomes a new or an acute chronic problem, or chronic inflammation becomes an acute inflammation, because shock waves cause microscopic injury to the tendon, and thereby there is reduction of the formed scar tissue. So, in addition to the other modalities, as I told you earlier, PRP, preferably under ultrasound guidance, as well as physiotherapy, and especially the shockwave treatment, which is done once a week for Achilles tendinitis, has shown to be a promising procedure, and we have carried out several treatments of this procedure, and the satisfaction rate is quite high, and clinically we have seen quite a remarkable improvement in comparison with other methods.